Assisting our residents with medications is much more than the mechanics of a pill pass or appropriate documentation. One of the most important jobs that we perform is to act as a resident's advocate. When our residents move into our residential care community, some are fortunate enough to have families that stay very involved and are very aware of the medication routines that the resident has. They help monitor for adverse events, reactions, and problems that the residents might have with each individual med they're on. Oftentimes, though, that responsibility falls to us. So a good med aid does more than just hand the pill to the resident. We're always watching to see how the resident responds to their medication routine. Are symptoms subsiding? Is the resident getting better? Are they having a good response to this medication? Great. Sometimes, though, when we give residents their medication, we get reactions we did not expect or reactions we do not want to have. Some residents may become disoriented, they may become nauseous, they may have problems feeling steady on their feet, all related to the medications they take.
Hi, Jean, what's the matter?
I don't feel so good. I've got a stomach ache.
Oh gosh, well I was just looking and it looks like you've been complaining of having a stomach ache ever since you started that new medication.
As our bodies age, we just don't handle medications as we did when we were younger. So it's critically important that when you notice something unusual, you report it to the physician right away. During the course of this video, you are going to hear about a variety of medication classifications and some of the adverse events that we might want to pay particular attention for. Remember, though, any change is important. It's not a requirement that you are able to identify a particular side effect to a medication, but rather that you notice, uh-oh, something's not right with my resident. I better get a hold of the doctor right away to report this. The physician or medical professionals will then determine what's causing this problem for your resident. So be a strong resident advocate and know the medications you're giving to the resident, know what the adverse events might be.
Sometimes a resident may have side effects with the pills that they take, so it's my job to observe those side effects and report it immediately to the physician.
There are a variety of problems that a resident may experience related to the medications that they are taking. An adverse drug reaction is a term used to describe the unwanted negative consequences sometimes associated with the use of different medications. Again, the most important fact to remember is to report any significant resident change to their physician. One common problem is that some medications put residents at risk for falls. It may be because they will experience excessive dizziness, or perhaps they will have problems with balance or a steady gait. There are a number of medications that our residents may take that could lead to orthostatic hypotension. Sometimes it's cardiac medications or medications used for high blood pressure, but it can also be antipsychotic medications as well, just to name a few. Orthostatic hypotension occurs when the resident stands and their blood pressure drops too quickly. If you are concerned about orthostatic hypotension, follow physician orders, which may include having the resident rise slowly. So for example, in the morning when your resident awakens, you'll have them sit on the edge of the bed for a few minutes and dangle their feet, and then stand up slowly with a caregiver very nearby to provide steady support if needed. A medical professional can determine orthostatic hypotension. At particular risk are our residents that use psychoactive drugs. Psychotropic meds may cause something known as tardive dyskinesia. Tardive dyskinesia refers to excessive unwanted movements of the mouth, tongue, and lips. Residents taking psychoactive meds may also do something known as pill rolling, which is excessive unwanted movement of the fingers. An unwanted effect from some medications is oversedation. If you have a resident that is falling asleep several times throughout the day and that is not their normal sleep pattern, or you have a resident that is becoming withdrawn or excessively lethargic, you'll want to let the physician know an adjustment in the medication may be necessary.
If my residents are on sedatives, it's my job to make sure that the doctor knows if they're over-medicated, if they're going through life sedated or not quite there. It's not a great way to go about their days.
Sometimes these unwanted effects happen initially when a resident is newly placed on a medication, yet will gradually subside. So work closely with your resident's physician. On the other hand, some medications may have the opposite effect and cause problems with insomnia for our residents. So again, if you have a resident with a history of sleeping well and they've started on a new medication and they're complaining, they're just uncomfortable in bed, they can't get to sleep, they're having trouble getting a good night's rest, talk to the physician so adjustments may be made. Some adverse drug reactions can actually be life-threatening. Bleeding is a major concern. If you have a resident taking Coumadin, also known as warfarin, or on a daily aspirin routine, you will want to monitor for signs and symptoms of bleeding. Things like tarry black stools, or bleeding when they brush their teeth, or frequent bloody noses can all be a major concern if a resident is taking such medications. A physician may indicate special precautions for these residents. Another potential crisis is the inability to pass urine. There are some medications that can actually inhibit the resident's ability to void. If you have a resident that is retaining urine, notify the physician right away. Emergency action may be necessary. Your resident may also exhibit a significant change in vital signs. A rise or a drop in blood pressure, a rise and a drop in pulse rate, for example. So in your community, if you routinely do vital signs and you see a significant change, that would be noteworthy. For example, a common medication that many of our residents take is digoxin. If the dig level is elevated, a resident may actually have a problem with a heart rate that is too slow. The adverse drug reactions that we have just discussed are but a small sampling of what you might encounter with your residents. You may also see change in cognition or thinking patterns. You may see nausea, vomiting, diarrhea, or constipation. You may find that a resident is eating less or eating excessively. Any significant resident change needs to be reported. Allergic reactions can happen with any resident. Even if a resident has a history of no known drug allergies, a spontaneous allergic reaction may occur. If you notice any type of allergic reaction after taking a medication, immediately contact the resident's physician and/or 911 as appropriate. Allergic reactions may include labored breathing, wheezing. You may also notice changes such as red blotchiness or itching. Any type of an allergic reaction must be immediately reported. One of the most difficult things we may experience as a med aid is when we commit a medication error.
One of the most embarrassing and frightening things that can happen to you is to make a med error. I've made a med error in the past, and if you work in this business long enough, you know that we pass hundreds of pills a day, and it's very easy to make a med error. But the most important thing to remember is to contact your supervisor immediately.
We feel devastated. We know that it's our professional responsibility to always give medication accurately. but we are all human beings, and medication errors can and do occur. The important thing to remember with medication errors is to be honest and report the error right away. Most communities define a medication error as a violation to any of the 6 rights. Know what constitutes an error in your assisted living community. Giving medications to the wrong resident is certainly a medication error. Also, giving the wrong drug, the wrong amount of a drug, giving the medication at the wrong time of day, or by the wrong route is considered a medication error. Let's talk about what we should do if a medication error occurs. Number 1, report the error to the resident's physician or seek emergency medical treatment as appropriate. Tell the physician about the error that occurred and then follow the physician's instructions. Oftentimes, a physician will simply tell you to monitor the resident closely for the next 12 to 24 hours. However, you may be asked to send the resident to the nearest emergency room. Secondly, the medication error must be reported to the resident's family. This is not an easy phone call to make. Sometimes families will become very angry with us when we tell them about the medication error. Remember, one of the primary reasons that they may have placed their loved one in our care is to assist with medications, and now we've made a medication error. You will want to clearly explain the medication error to the family, also indicating what action you've already taken, that the physician has been contacted, and what the physician's instructions are. Next, we will want to monitor the resident very closely according to physician's orders. Oftentimes, protocol will include checking on the resident every 15 minutes for the first 8 hours after a medication error has been made. Follow the documentation guidelines for your facility related to medication errors. After the resident has been appropriately cared for, you are going to want to discuss the medication error with your supervisor. Analyze, try and decide exactly how did this medication error occur. Were there any underlying factors? Oftentimes, medication errors result from not following the protocol for which we were trained. We try to hurry up, we try to cut corners, and in our effort to save a few minutes, we may in fact make a very serious med error. Remember, the most important thing about medication errors is do not be afraid to report the error. Reporting the error will ensure that your resident receives the appropriate care necessary to avoid any long-term negative effects from the medication error. About all the skills you've acquired learning how to assist your residents with medications. Congratulations on your continued dedication. Working as a med-aid means being dedicated to a lifelong pattern of learning, enhancing our medication pass skills, and learning more about the medications we give. Continued success to you as you further your med-aid career.